Hello guys, what's up? My name is Vaughn and welcome back to my channel. So today's video, we will be discussing about the difference of nursing in the Philippines and in the UK. But before anything else, I would like to thank all the new subscribers and those supporting my channel. Maraming salamat. I cannot make this far without you guys, and I am truly inspired by all your feedbacks, comments, and suggestions about the videos that we are making. So always stay tuned so that you can get the latest updates about the life and nursing here in the UK. So for today's video, as I have mentioned a while ago, I have made a list of the differences between the nursing back there in the Philippines and the nursing here in the UK. So let's compare the differences and the ways how nursing is done back in the Philippines, and if you are curious, how is it done here in the UK. So are you excited? So let's go.
Hold up.
As a disclaimer, this list is just based on the general experiences of the nurses back in the Philippines and also the nurses here in the UK. So if you have any corrections, suggestions, or feedback, you can drop your comments down below and tell us what you think about the list, alright? So let's begin. So in the Philippines, if you pass the licensure exam for nurses, you are called a registered nurse or the RN or an RN. Back here in the UK, if you pass the OSCE, the CBT, and the competencies, you are called not an RN, but a GN, or a graduate nurse if you're a graduate here in the UK, or a staff nurse if you are working in a hospital. And then if you progress, you are called SSN, or a senior staff nurse. Or if you are working in a mental health facility, because that is a different registration, you are called RMN. So there is no really UK RN as what we can read from all the adverts in the Philippines, that you become a UK RN, although we consider ourselves as UK registered nurses, but there's no really UK RN terminology here in the UK. So you're just called a nurse, a staff nurse, and a licensed nurse here in the UK. In the Philippines, we call our card for you to be able to practice your nursing. You should have your license, and you need to renew it every 3 to 5 years. Am I correct? Comment down below if it's still renewable by 3 years or 5 years. And to renew it, you need to have your continuous professional development, or the CPD. You need to fill out the forms, you need to submit your ID picture, you need to pay, and you need to do it at the PRC. But here in the UK, in order for you to practice nursing legitimately and legally, you should have your Nursing and Midwifery Council PIN. We call it the PIN. You need to have it revalidated, and you will have your revalidation. It seems like back in the Philippines, it seemed like the renewal of your PIN. So you have your revalidation every 3 years. And unlike in the Philippines, revalidation is a process of you meeting someone like your mentor or your senior staff nurse, and then you have to discuss a reflection, you have to discuss the patient or staff or mentor feedback. You need to present your list of training, and you can do it with anyone with a registration number or a PIN. Not unlike in the Philippines that you have to do it at the PRC. Here in the UK, you can do it anytime within 3 years, or usually just before you reach your 3 years, or after 3 years, do it with someone with a PIN that is also duly registered in the Nursing Midwifery Council, and it is actually for free. So that's the difference between the registration in the UK and in the Philippines. Now back in the Philippines, I remembered we are required to have the IV therapy license, or the license to perform intravenous therapy and give intravenous injection. And I think it was a 3-day training back there in the Philippines, and you have to comply the cases of competencies like 5 IV insertions. Correct me if I'm wrong, like IV insertion competencies and giving IV medications. But back here in the UK, you also have your IV competencies and training as well. But unlike in the Philippines, you need to pay for your own training. Back here in the UK, it is given or provided by the company or the hospital for free. So before you can give your IV medications, you must have your IV competency. But it is also a different competency or training for you to be able to cannulate the patient. So unlike in the Philippines, that when you do the IV therapy training, you can do or give your medication or insert the IV cannula. But here in the UK, the IV therapy training is more of the giving or administration of intravenous therapy or medication. And then if you would want to cannulate or insert in an IV cannula, you must have another competency or training. So those are two different things here. And not all nurses are doing the IV cannulation here in the UK. You would find that in your shift, if you are here in the UK working, that your sister or your senior staff nurse are not doing IV cannulation. So if you are competent and you have the competency, or someone has the competency, they would require someone to do the cannulation. Not really, you're not forced to do it if you're not competent to do it here in the UK. So that's on a legal basis. Alright? Another thing, so back in the Philippines, we are also required to have the basic life support and the ACLS or the Advanced Cardiac Life Support. Here in the UK, we also have the same thing. We also have the basic life support as a starter for all the nurses and healthcare providers. The next would be your ALS or the Advanced Life Support. And then there are also other kind of trainings where you can give the ILS or the Immediate Life Support. And then there are other life support trainings here in the UK. So there's a lot of trainings provided here in the UK. Right, so in the Philippines, the members of the team are as follows. In general, we call it the staff nurse, the senior nurse, the head nurse, the supervisor, or the chief nurse. Alright? Back here in the UK, we have the junior nurse, or we also call them as staff nurses, the senior staff nurses, and then we call our in charge as the sister or the charge nurse. And then the sister or the charge nurse can be grouped into junior sisters or senior sisters, or junior charge nurse or senior charge nurse. So those are two different rankings. And then we also have lead nurse, the matron, and then the director of nursing. In terms of specialization, back in the Philippines, we have a generalized specialization, if that makes sense. It is just usually based on the area you are working. Say, for example, if you are a hemodialysis nurse, you are the specialist on that area. Operating room nurse, you are the operating room specialist nurse. But back here in the UK, we have all sorts and kinds of specialization, from all the types of specialization and all kinds of roles of nursing. There's a lot. Like, there are lung specialist nurses, ECMO specialist nurses, renal transplant specialist nurses is different from the renal nurses, IV therapy nurses. There are so many specialization here in the UK. So if you will come here in the UK and work, and you would want to progress with your profession, there are a lot of trainings you can get for you to be specialized in a specific specialization. Okay, so back in the Philippines, we call our gathering before the shift starts as endorsement. So we endorse the patient from the outgoing to the incoming staff nurses or group of nurses. Back here in the UK, we call it handover. So we hand over the entire shift to the incoming nurses or group of nurses. In each and every specific locations here in the UK or wards, there are different types of handover. There are different styles of handover. So it's not just one template of handover or endorsement. Okay, so back in the Philippines, we have the time in and time out. So that's really strict. Like, you don't have to be late, or you can never be late in the Philippines, or else you will have a salary deduction, or you will be called the human resource. Back here in the UK, we don't have the time in or time out, but punctuality is really important. If you are gonna be late, you need to inform the shift manager or your coordinator or your nurse in charge on a specific shift, so that they would know whether you can come or not. If you will be absent, you can call few hours before the shift starts, and they will find another staff to replace you so that the staffing will still be in balance. So unlike in the Philippines, let's admit it, it's quite different and it's quite difficult, right? Back in the Philippines, we call almost everyone, may it be our senior or our colleague or the patients, as sir or ma'am. Here in the UK, generally we call them by name. If you know their first names, we call them their first names or their family name. We call sometimes our doctors as doctors if you don't know the doctor personally, but if you know the doctor and you've been working with a particular doctor for a long time, you can call him, like, say, Mike, or you can call him Alex. Whatever the name of the doctor is, you can call him by his first name, and that is not offensive and that is not rude to do so, because here in the UK we do and we call everyone on a first name basis. As much as I can remember, we call our shifts back in the Philippines as, say, early or late shift or graveyard shift, or sometimes we call it 12-hour shift. But here in the UK, we also call it the same, but we also have long days, the nights, because sometimes, generally on the wards, we do 12-hour shifts, or there are some areas or specializations or specialized area that they do also early shifts, late shifts. It is just different in terms of what time they will start. There are wards that starts at 8, there are wards that starts at 7 or 7:30, and they go on a long day or an early shift or a short shift. So yeah, that's the difference. In the Philippines, it is really nice to have lunch break, and it is mandatory, of course, to have lunch break, but sometimes we don't get our lunch breaks or even our bladder breaks. But here in the UK, we have mandatory breaks. If you do the long day shift, you will have your breakfast, which is like, say, 15 minutes breakfast, and then you'll have 30 minutes to 45 minutes lunch, and then another 15 minutes to 30 minutes dinner break. So that is really important. Mandatory breaks are compulsory here in the UK because they tend to value the staff in terms of not getting burnt out, and this is also to prevent errors and promote patient and nurse safety. So that is really a good take for UK. In the Philippines, we call making or reporting an incident as incident report, but here in the UK, we call it day takes. In the Philippines, we call our extra shifts as overtime, or the time we go beyond our stipulated working hours. But here in the UK, we also call it overtime, but mostly they call it bank shifts. So that is paid, extra paid shifts for you to be able to, like, do on your day off or your extra hours. So this is beyond or out of your regular hours in a week. Since we are almost talking about salary, back in the Philippines, we receive our salary 15th and 30th of the month. But here in the UK, normally and generally, we receive it every month. So just once a month. So it's either 27th or 29th of the month. It depends on the employer, or there are employer as well that gives the salary on the 30th or the last day, last regular working day of the month. Last but not the least, in the Philippines, before you become a regular staff, or we call you a regular staff, you need to pass your probationary period. But here in the UK, you have to go on with a supernumerary period or a probationary period, and then after you completed all your competencies and then you are evaluated by your mentor, you can be called as a permanent staff. There are also staffs that are called temporary staff because they are just also doing part-time, and there are also agency nurses, bank nurses, permanent and regular staffs. So there are a lot of terminologies here in the UK, and most especially when you are working as a nurse here in the UK. Alright, so I hope you've learned something for today. Drop some comment down below if you would want to correct, or you would want to ask, or you would want to do some feedback. Let me know what you think about the differences of nursing in the Philippines and back here in the UK. Once again, I would like to thank all the new subscribers and all the followers out there. Maraming salamat. Thank you very much for always continuing and supporting my channel. So if you like this video, please press the thumb like button, the bell as well, so that you can be notified. Share this to your friends, comment down below, and of course subscribe if you haven't subscribed yet. So thank you very much for watching this video, and see you on the next videos and adventure. Bye!